Hi, I'm Spring McCann. I'm an anesthesiologist, but I do 100% chronic pain and interventional pain. We treat a wide variety of pains. We mostly treat spine pain, joint pain, and muscle pain. Spine pain being necks, mid-back, low back pain. Joints, mostly hips and knees. There are many different treatments that we use for these pains. We are big proponents of physical therapy, so we'll often send people to physical therapy. In our office, we do injection therapy, and there's many different types of injections we can do. The injections that we do are based on what your symptoms are. So we can do epidurals, transforaminal epidurals, spinal cord stimulators, medial branches, radio frequencies, genicular nerve blocks, many different types of injections. Our pain management goals are to help the patient be able to do their daily activities on their own or go back to work if they are currently working. We often hear people saying they'd like to have 100% relief of their pain. That's often not able to be accomplished, but we'd like it to be tolerable for them. So on your first visit, you're normally brought back by a medical assistant who'll get your vital signs and get your past medical history, including your medication. So it's always important to bring your medication list with you. We're always interested in that. We also review your chart, and then we'll come in and speak to you and also do a physical exam. And we're going to try to decide what is causing your pain. And if we don't know what's causing your pain, then we're going to try to figure out what's causing your pain, often via getting imaging for you. Typically on your first visit, we will not be able to do an injection for you. There are insurance constraints allowing us to do imaging sometimes, allowing us to get x-rays. Oftentimes, if we're going to do further imaging, such as MRIs, we're also going to have to get an authorization before we send you for that MRI. If you already have an MRI and we already know what we're treating, we then often need to get an authorization before we can even do the injection for you. And we use the information that we've included in our note to get your insurance company to authorize that particular injection for you. On the day of an injection, you're first brought back by the medical assistant, and we get your vital signs, and she'd also get your past medical history, including your medication list. And then you would see your physician so that they could answer any questions you have prior to the procedure. Then we will take you back to the procedure room, and you'll get your injection by your physician. After the procedure is completed, you will have to stay with us for approximately another 10 to 20 minutes. In that time, we will do vital signs one more time and see what your pain level is before we allow you to leave. The amount of time it takes on the day of your visit to have your whole visit completed, including your procedure, is approximately an hour. We are currently in the process of getting the Iovera procedure at Uniontown Hospital. This is a procedure that's used for knee pain, and cryo is actually very cold temperatures. We apply that to the nerves, and that allows the nerve to die off for a few months, therefore relieving your pain. In the long run, that nerve is going to come back, but if it does, we could do the Iovera procedure again. So the Iovera procedure is often used as a treatment prior to getting a knee replacement to decrease the amount of pain you have after that replacement.